Hey guys! Well, this is about as real as it gets. I literally just finished my shift and I came here to make this little video for you guys. I'm going to give you a few guesses. What do you think I do? I'm dressed in scrubs. I'm standing next to this funny machine over here. I'm in a hospital room. I bet you want to say a nurse. Nope. Not a doctor either. But I am a very important person in the hospital, and I work in every situation that a nurse and a doctor works in. I'm right there beside them, but most people don't know about us and what we do. I am a respiratory therapist, and I love what I do. I am involved in everything that involves breathing. So if you have asthma, you've probably seen a respiratory therapist. If you come into the emergency room and you can't breathe, I'm the one that gives you the medicine and the mask. Looks like clouds, the little mist, to help your breathing. I draw blood samples, and if you're really, really sick, or maybe in a car accident, I'm the one that has to put the breathing tube down. Sometimes the doctor does too. But once the breathing tube is in your throat, we hook you up to a machine called a ventilator. Some people call it life support. That's where I come in. My job is to make sure that this machine does its job. I make sure that all the numbers are right, and I make sure that the person that it's taking care of is comfortable breathing through the machine. That's my job. So I wrote down a couple little pointers on my sticky note. I'm going to try to keep it to 10 minutes. I just told you what I do. I do breathing treatments. I help in the intensive care unit with life support. I draw blood samples. There's a couple other things we do outside the hospital too. Sometimes we work in a doctor's office doing pulmonary functions tests. Sometimes we work with little kids. Sometimes we work with little tiny babies that are just newly born and their lungs aren't ready yet to go home. You can find respiratory therapists all over the place. We even do home care. There's some respiratory therapists that travel to the home and help people who are not in the hospital just to stay in good health so they don't get sick and come to the hospital. As far as skills and strengths, just about anybody who works in a hospital has to be good under pressure. Sometimes things can get pretty scary and you have to be able to stay calm and think clearly. You have to be able to problem solve. There's a lot of problem solving when you're taking care of patients who are sick. As far as education is concerned, I was a little bit different. I grew up in Canada and I did my education for respiratory therapy in Canada. So I only did 2 years for my program. But there are several different schools here in Georgia that teach respiratory therapy. Some of them are 3 years, some of them are 4 years. So it's usually about 3 or 4 years of college after high school in a specific program for respiratory therapy. When we graduate, that's when we decide where we want to go work. In the hospital, in home care, with the babies, in a doctor's office, any one of those places. A normal day for me. So we work 12-hour shifts, which is a very long day. If you can imagine, you spend about 8 hours at school, add another 4 hours onto that. So I get to work at 7 in the morning and I stay till 7 at night. But I only have to work 3 days a week. It's a pretty good trade-off. I still get half the week off. We do work holidays and summertime, because the hospital never closes, right? So we have to work those days too. A lot of respiratory therapists work at different hospitals. I work at 2 different places, but that's because we have plenty of days in the week. So a normal day, when we come into work, we find out which area of the hospital we're assigned to. Some days I work only in the ER, some days I work only in the ICU, and some days I work out on the floors with the patients who need breathing treatments. So we go around all day long giving medicine and taking care of those patients, and in between our scheduled stuff, sometimes emergencies happen and we have to run and help those people too. That's where the problem solving comes in, and that's where the time management comes in, and staying calm under pressure. The best part of my job definitely the best part of my job is when I take care of a patient for several days that's been very, very sick, and I'm worried about them. When I get to see them get better, come off the breathing machines, and go home to their families, or even come back and visit us, that's definitely the best part of my job. I love seeing people get better and come back happy and healthy with their family. The biggest challenge, you may not know this one. I think the biggest challenge is the emotional side of my job. It's really hard when you're dealing with people to stay calm and not to get upset or discouraged. When people are sick, they are frustrated, they're scared, they're sad, and having to deal with those things can be really hard as a healthcare provider. So for me, I think that's the biggest challenge. When you're talking to people, patients or their families, and they're upset and they're scared, you have to be confident and you have to stay calm and you have to help them get through very difficult times. That's a challenge sometimes. How has the coronavirus changed your job? The biggest part about my job changing is that I have more patients that are very sick. So it's really put my skills to the test. I've had to do a lot more troubleshooting and a lot more really heavy thinking on how to take care of these patients because they're very sick. It takes a lot more time because we want to protect ourselves. We have to cover up with gowns and masks and goggles. So it takes extra time before we can even come into the room. And that makes your day even harder when you still have the same number of people to see. So if I'm out working on the floor and have to give 30 people breathing treatments, now each one of them I have to put on a gown and mask and goggles for. It adds a lot of extra time to the day. The patients who are really sick in the intensive care unit, I really have to stay close to them and work very carefully with their ventilators to make sure that they get over the virus. So the virus has changed my job in that it's made it a good bit harder and it takes a lot more time to do everything. But I still love what I do, and I'm very happy to be working as a respiratory therapist. I hope it's something you might look into. It's very rewarding and very stable as a career. People always get sick, so healthcare workers are always going to be needed. I hope this has been informational. I hope I didn't run over too long. Y'all have a good day and happy career day.